Hello, my name is Chance Bolter, and today I'm bringing you the Lab 1 video for Kinesiology / Biomechanics. Here I have my model Viviana, and today we're going to talk about a few anatomical positions and terminology. The first term I want to talk about is superior. Superior meaning above. So for Viviana, her head is superior to her feet. The next term I want to talk about is inferior. Inferior meaning below. So for Viviana, her feet are inferior to her head. The next term I want to talk about is anterior. So Viviana being in an anatomical position right now, this is the anterior part of her body. It's the front. Anterior meaning in front. The next term I want to talk about is posterior. This is the posterior side of Viviana. Posterior meaning the back, or the back up. Next term I want to talk about is medial. Medial meaning closer to the midline. So for Viviana, her pectoral muscle is medial to her deltoid. The next term I want to talk about is lateral. Lateral meaning further away from the midline. So for Viviana, her deltoid is lateral than her pectoral muscle. The next term I want to talk about is proximal. Proximal meaning closer to the point of attachment. So for Viviana, her knee is proximal to her hip. The next term I want to talk about is distal. Distal meaning further away from the point of attachment or going away. So for Viviana, her foot is distal of her hip. Now let's talk about anatomical planes and movements. The first plane I want to talk about is sagittal. The sagittal plane cuts the body into left and right pieces. A couple movements we see here is dorsiflexion, meaning toes up, and plantar flexion, meaning toes away. The next plane I want to talk about is the transverse plane. The transverse plane cuts the body into superior and inferior planes. A couple movements we see in here is horizontal abduction away from the midline and horizontal adduction closer towards the midline. The next plane I want to talk about is the frontal plane. The frontal plane cuts the body into anterior and posterior planes. A couple movements we see regarding this plane is elevation and depression. So for Viviana, we're going to elevate the shoulders. Here's elevation, and depression, we're going to depress the shoulders back down. Thank you for tuning in to the Lab 1 assignment for Kinesiology and Biomechanics. Thank you.